So let's rewind to non-muscle invasive bladder cancer. You and I were in Vegas at AUA. We covered the CREST data, which was the first readout of that trial. And we saw some further update at ASCO 2025. Chris, why don't you take us through that?
Absolutely. So as we know, Neil Shore presented the first readout of CREST at AUA, and we got an update from Tom Powell's here at ASCO looking really at subgroup analyses based on disease stage and some PD-L1 based biomarker attempts. And so, to level set and remind ourselves as well as the listeners and viewers about the CREST study. So this is patients who are BCG naive, high-risk non-muscle invasive bladder cancer, 3-way 1-to-1-to-1 randomization to either our current standard of care, which is BCG induction followed by maintenance therapy. The exact same thing with the addition of the subcutaneous IO sanzilizumab, or the sanzilizumab plus BCG induction and omitting the maintenance BCG. So those are the three arms. Our main focus is on the BCG induction plus maintenance with or without the IO. And so that's arm A versus arm C in the trial. And that's the one I think we most want to focus on because that's the one that in the primary readout at AUA showed some differences. We didn't really see a benefit between that B to C comparison where you're dropping the maintenance. So I think we'll focus a little less on that. And so, if we remind ourselves from the AUA, we saw that there was an improvement in event-free survival for patients receiving the sub-Q IO, a hazard ratio of 0.68 in the overall intention to treat cohort. But we know that, there's pretty substantial heterogeneity within high-risk non-muscle invasive bladder cancer. And so this real talk today or our talk at this meeting was to try and understand that a little bit more. And not surprisingly, the worse the disease is, the more the patients benefited from the addition of that sub-Q IO.